Hello friends. So in today's video, we will be continuing our discussion on the health sector. Okay. In this video, we will be discussing about the challenges related to health sector. What is a major scheme carried out by government in health sector and what is the progress of the scheme? Okay. So to give you a pre-context to what is the discussion ongoing, we have started our discussion from the immunization programs. Basically, India and Indonesia has helped this Southeast Asia region to come to the top-notch level in WHO's immunization program. Okay. So because of this, we started our discussion with immunization. So whatever are the immunization programs in Government of India is conducting. Okay. And now we are discussing what are the challenges prevailing in the health sector. Okay. So coming to this, there are different challenges for both rural and urban areas and we will be tackling them differently. Okay. So to begin with the rural area, the biggest problem is that of infrastructure of primary health centers. So primary health centers are set up on the basis of a population criteria. The criteria is for every 30,000 population, there will be one PHC put up in plain areas. If it is a hilly area or a tribal area, even for 20,000 population, we will be putting up a primary health center. In every primary health center, the government is supposed to put up one doctor, one supporting staff along with the other infrastructural facilities. Okay. The problem now in rural area is that such kind of infrastructure of PHC is completely lacking. As per the ground reports conducted by surveys from various organizations, NGOs, they have observed that there are certain PHCs in which only one room is present with absolutely no other facility other than a bed, a basic table, fan and light. Okay. Sometimes the doctor is present, at the other times they are not. Okay. If we see the numbers, out of all the PHCs that have been set up, 7.6% of the PHCs do not have doctors, and 61% of the PHCs have only one doctor with no supporting staff. So the quality and the quantity of PHCs is terribly poor in case of rural areas, because in rural areas there is no motivation for a doctor to work, right, in a remote location. So they will avoid doing so. All in all, the doctor availability is very poor in rural areas. So that is the biggest problem there. Coming to urban areas, in urban areas, one big problem that we need to tackle is to bridge the gap in hospital services between tier 1, 2 and 3 cities. So, for example, if we are talking about any particular disease, let's say TB or measles, the treatment that is carried out in tier 1 city and the one that is carried out in tier 3 city is significantly different. Okay. The number of tests conducted, the preventing medicines, the vaccines, whatever is being provided in tier 1 city is way higher, much more as compared to tier 2 or tier 3 city. So this gap should be bridged. Okay, in case of urban area, this is one of the problems. This gap is very huge and this needs to be bridged. The second problem is the contribution of private sector. It's actually not a problem because private sector is highly prevailing in, let's say, tier 1, 2 or 3 cities, but in urban areas only. Okay. If we are talking about the number of hospital beds, okay, 2/3 of the hospital beds are provided by private sector. Amongst this also, we would have expected hospitals like Max or Fortis or Medantu or Manipal hospitals having maximum presence in urban area, or they should be providing the maximum number of hospital beds, but that is not correct. If we go by statistical data, the large chain of hospitals, the one such as Fortis or Max or Medantu or Manipal hospitals, they are contributing to only 4 to 5% of the number of hospital beds. Okay, but the standalone hospitals, the nursing homes, okay, small clinics, they are the ones that are contributing to 95% of the hospital beds. So they are the ones who are significantly affecting health care services in private sector in urban areas. Okay, now actually this would not have been problem if they were affordable. Private healthcare facility is highly not affordable for a common man, for a middle person belonging to middle class. So we need to either make this affordable or increase the public health services in urban areas also. Okay. Now coming to the third problem, that is related to health insurance. So with respect to health insurance, we have so many services. The state runs insurance facilities, ESICs. The government came up in 2018 with Ayushman Bharat program. So that's also an insurance scheme. So there are too many health related insurance schemes ongoing. But despite of all of them, only 74% of the Indians are insured right now in health sector. Now that becomes a problem, because once any person requires medical emergency services, then that time it will become very expensive for the person. If over a period of time they have deposited money for any health related issues, and at the time when they need it, it would be easier for them. It will not be a burden for them. Okay. So this health insurance, which is not given too much importance after 2018 launch of Ayushman Bharat scheme, we have enrolled too many number of people in this health insurance sector. But despite of that, not every Indian is insured. Okay, 74% of the public is still insured, 26% is not. Okay. Another problem is that of unorganized middle class left out of the purview of health sector itself. Because for unorganized middle class, we have not checked them, we have not assured them affordability or accessibility of healthcare services. So they are being left out of the purview of this entire health facilities that is being provided by the government. Next problem is that of lack of accountability for machine-made medical decisions. So we know that nowadays we have also started adopting machine-made decisions. So a surgery is also assisted by machines. Now, if a mistake is done by a machine, let's say hypothetically, but it is happening actually. So if a machine does a mistake, then who is accountable? Okay, so there is lack of accountability for machine-made decisions. This is also a problem in urban areas. So overall, we can categorize this problem into 5 A's. One we have already discussed, that is affordability. In affordability, we have discussed that the prevalence of private sector in healthcare facilities has made it very costly. The healthcare services have become very costly. So we need to bring it to the affordable level. Apart from that, awareness is a very big problem which we have ignored over a period of time. Many of us are not even aware of the medical problems that can occur because of certain practices that we are following. Okay, it was carried out that the worst the minimum amount of information is related to reproductive issues and menstrual cycle amongst women themselves. Okay, girls themselves are not educated about the menstrual cycle or reproductive issues. They are not informed about, or they do not have knowledge about institutional deliveries, the safety factors that can be inculcated if the baby gets delivered in an institution. All this knowledge they are not having. They have a mental precursor that through all these years, especially in rural areas, this work has been done by a midwife. So I do not need to come to hospitals, I do not need to come to any kind of institutions. Everything will be handled at home with care. Okay, there is lack of knowledge amongst them. What will be the problem if you are not able to maintain the safety standards, the hygiene standards? Okay, so there is lack of awareness related to institutional deliveries about their own health. Okay, if we talk about the rural areas, especially women, there are a number of issues associated with them, especially hypertension, BP, diabetes. And if you try to convince them, they will say that we are already conducting so much household chores that I do not need to spend time for my health services. I do not need to give special time to it. Okay, so all in all, they are not prioritizing their own health. For them, it is a priority that rest of the family should feed, and they will be coming later in the picture. Because of this, we have witnessed that overall across India, anemia prevalence is significant amongst women. So there is lack of awareness about their own health. Another very big persistent issue is that of antimicrobial resistance or antibacterial resistance. This issue comes up because of self medication. Okay, if we are having particular disease, we do not prefer to go to doctor and start taking medicines on our own. It is not a problem if it is not an antibiotic, but if it is an antibiotic, you need to understand its course, you need to complete the course. Okay, people tend to stop taking medicines once the symptoms goes away. That leads to bacterial resistance against that medicine. and antimicrobial resistance is a very big problem prevailing in India. Okay, so because of lack of awareness, again, antimicrobial resistance has developed in India. Next problem, next A is that of lack of access. Quality and quantity of the healthcare professionals, we have seen the primary health centers availability and the infrastructural facility within a PHC is terribly poor, and there is absence of manpower. Okay, the number of doctors that should be present per certain amount of population, this ratio is very poor in case of India. Okay, and next comes the lack of accountability. In case of, we have already discussed this point also, this is just a way to remember the problems, 5 A's. So lack of accountability in case of any mishap, be it related to machines or be it related to doctors, who will be accountable for such kind of accidents occurring, and how to get hold of this accountability, what will be the benefits that will be given to a person if they face any kind of mishap. So all this will be covered under this problem. Okay, now with that we will conclude our today's discussion. We will continue our discussion related to health sector services. I wish you all the very best and thank you so much.